April is Sexual Assault Awareness Month. All month long, we've been making a special effort to raise awareness around the issue of sexual violence and to provide helpful information to our community in an effort to empower survivors and to prevent sexual violence. Those resources can be found on our website as well as on our Facebook page and Instagram pages. Today, we've gathered some of the experts in this field, some of the responders and service workers to answer some of the most frequently asked questions about sexual violence and how to get help or how to help another person if this is something that you or someone you know has experienced or been impacted by. Courtney and I will be taking turns asking each of these participants some of these questions. And we hope that the conversations that we have today will be empowering for our community. Before we get started, we'll all go around and introduce ourselves. My name is Brianna, and I am the education manager at Dove Center. And Courtney will be hopping on a little bit late. She is our education coordinator.
My name is Elizabeth Bloom. I am the Rape and Sexual Assault Recovery Services Manager. I also coordinate a group of volunteers and staff who are trained to respond to the hospital for sexual assault kit exams.
Okay, my name is Cami Kaifa, and I am the Clinical Program Director for Southwest Forensic Healthcare. We're a forensic nurse team that practices at St. George Regional Hospital, used to be known as Dixie Regional Medical Center. And we are a group of specially trained forensic nurses who do the medical forensic examinations.
So I am Chilliance. I work for St. George Police Department. I am the supervisor over the detectives that work the sex offenses in St. George.
And I'm Christy Pike. I'm the director of the Washington County Children's Justice Center. So we have services here for children who have been victims of crimes, including sexual assault.
My name is Carly Parsons. I work at the Dove Center as a mental health therapist, working primarily with our adult survivors here at Dove.
Thank you all so much for joining us today for this conversation. We're really happy and grateful to have all of you in the community. Just to jump right into some of these questions, the first one is going to be for Elizabeth. And from a perspective of somebody who may have experienced sexual violence, the question is, what should I know before I go to a sexual assault kit exam?
Well, you should know that it's going to be in the emergency department at the St. George Regional Hospital. The exam you will not have to pay for it. The hospital will bill your insurance if that's what you choose. And the Utah Office for Victims of Crime will pay for the exam. It's a forensic exam. They're going to be gathering evidence from your body and your clothes. So you'll want to bring the clothes you were wearing when you were assaulted, if you're not still wearing them. Bring them in a paper bag so that evidence doesn't degrade. The exam needs to be done within 5 days of the assault. And the sooner you come in, the better, because you don't want to risk an unwanted pregnancy. You will be given the option to take emergency contraception to avoid an unwanted pregnancy. You will also be given the option to take prevention medicines against getting sexually transmitted infections, in addition to getting a medical exam to see if there are any injuries that need to be treated. So you should, try not to eat or drink before you go in. Try not to bathe or shower or clean yourself in any way. I would call a supportive friend if you've got one that would come with you. The thing you need to know is it's kind of a long process. It's about a 3-hour long exam. An advocate will be called to be with you for the whole time if that's what you want, or they can just be there for part of it, however much you want. This exam, you are in charge of it. And the forensically trained nurse is going to be looking on your body for evidence of the crime that happened to you. And you are dictating where that evidence might be, telling her what happened to you. Okay. And it's your choice to have this reported to the police. You'd have the option to speak with police about this or not, but the evidence can be collected in the short time frame that it can be, and you can take more time to think and decide for yourself once you know all the options, whether you're going to report or not.
That's all really helpful information and so helpful to know before going into that. I know it can be kind of scary when you just don't know what to expect. So thank you for going through all of that for us. Does anybody else have any thoughts about that process or questions for Biz about that?
Maybe we should have clarified this at the beginning, but depending on age range, there are different places for the medical forensic exam. So if you're 18 and up, then the hospital is the best place for the exam. And if you're under 14, the option is at the Children's Justice Center. And then if you're that 14 to 17 age range, then you actually have choices to go to the Children's Justice Center for that exam or to the hospital. So I just wanted to clarify when we're talking about different age groups here today, because sexual assault can happen at any age, unfortunately.
Thank you, Cami. Thanks for clarifying that.
Thanks for the clarification.
Yeah, that's really helpful. Well, another question for you, Biz, is if I just wanted to talk to somebody, but I wasn't feeling ready to report, can I still get help?
Yes. There are a couple of numbers I'd like to throw out there. There's the National Sexual Assault Hotline, which is 800-656-4673. Again, that's 800-656-HOPE. There are trained advocates who will respond to that call to walk you through, talk you through what you need to. They were trained listeners. In addition to that, locally, we have the Dove Center. We have a 24/7 helpline. That number is 435-628-0458. This is, as I say, it's staffed by trained victim advocates, and you can learn about the options. You can learn about the exam. You can, help understand what an investigation looks like. Often people call in and just say, something happened to me and I'm not really sure if this was a crime. I'm not sure where the consent went and where it became non-consensual, or they just want somebody that's kind of like a sounding board that's going to listen. And a victim's advocate can do that for you, can listen and help you understand when it became non-consensual, at what point it became a crime. And then what happens next if you decide to report, what happens if you don't, and then they will be giving you information about how to stay safe from, STIs and from an unwanted pregnancy and that kind of thing, and where to go and resources. So yes, there is help.
One thing I would like to point out, I know that the victim advocates that work at the university, at Dixie State University, they do have to make a report. Is that right?
That's true. On university campus, anyone you disclose a sexual assault to is a mandated reporter, except a community-based advocate. So Dove Center has advocates at the Women's Resource Center from 3 to 5 on Mondays. And we meet with walk-ins, and you don't need to make an appointment or anything, just show up. And anything you disclose to us is kept confidential completely. We just help you understand your options. And if you want referrals after you've spoken and decide to go forward, we give you the information you need. But we are not mandated reporters for adults, only for children. And Christy's going to give you the phone numbers and the contact information if you are in that age group for seeking out help.
Yeah, just to add to what you had to say there, Biz, everybody, actually, all adults in the state of Utah are mandatory reporters for child abuse. So child abuse has a little different, child sexual abuse especially has a little different mandatory reporting requirements than adults, and all of us are mandatory reporters. And the number to report child abuse is 855-323-3237, and that number can be made available. That's here in Utah. So when you seek help from your school counselor, from a doctor, from law enforcement, or anyone else, your therapist, your clergy member, we take keeping kids safe really seriously here in Utah, and they are required to report that abuse. So you should know that.
Thank you so much for adding that in. Is there any other thoughts that anybody would like to add about all of that? Okay, I saw Courtney jump in. So I will let her take the next few questions.
Perfect, thank you. Yes, so I missed a little bit of that, but Camden, your question, your first question that we asked you to answer is, if I don't want to report to law enforcement, why should I get a sexual assault kit exam? And Biz already kind of touched on this, but I would love your input and if you have any other details or options that you can provide.
Yeah, absolutely. And so I am going to focus a little bit on the 18 and up to begin with. So once you've had your 18th birthday and you're determined to be an adult in the state of Utah, there essentially are 4 options if you were to show up at the hospital. The first option, and probably the least frequently utilized, is strictly just medical care. So you would see an ER provider, discuss, what needs you have and wants, and they would provide medications and referrals to the Dove Center and to other medical providers, but they wouldn't call in a forensic nurse in those cases. Then there are the 3 other options are that you have a medical forensic examination by a forensic nurse and you choose a restricted kit. So a restricted kit is one that you can get the full medical forensic examination, including evidence collection and what we call a sexual assault kit. And that would then be stored but not tested. So that gives that survivor an opportunity to not make maybe some of those critical decisions in this moment of trauma about whether or not they wanted to go forward with an investigation or even having their kit tested. So that is one option. And I will tell you that it is also pretty minimally used in the state of Utah. We're somewhere between a 2 and 5% restricted kit range currently. Then there's the medical forensic examination, in which they are just choosing no interview at this time. So they do want their kit tested and their toxicology tested, and they want to have that full examination, but they may not be ready to have an investigation. And so that would be something we would work with law enforcement, and Julie will tell you a little bit more about the investigation process, but it is one thing that we can offer survivors when they're just maybe not ready for the full investigation. And then of course the other, which is probably the most common, is that they come in, want a full medical health care, full sexual assault kit collected, and they want law enforcement, one, to protect them and also to protect others through an investigation. So those options are presented when a survivor shows up at the ER. And I just want to reiterate what Biz said, that these patients will never be charged for this examination from the ER. We do ask permission to bill their insurance, but they are not responsible for a copay or any other portion of the examination if they're there for a sexual assault exam. And so the Utah Office for Victims of Crime, the CVR fund, helps pay any additional fees for the forensic nurse or the ER staff to help take care of that patient. I will say that the medical forensic examination is primarily focused on health and wellness. So we really take their medical needs in the highest priority. And like Elizabeth said, that includes the STI prevention, emergency contraception, should they choose it. We evaluate them for HIV and PEP, should they be at high risk for that within the 72 hours of assault. And we really focus, from a trauma-informed approach, empowerment of that survivor, letting them make a decision. So just because they come in and they say they want a sexual assault kit or examination, they get to choose any time along the path what they're willing to do and what they are not comfortable with. It's not a have to at any point, so they get to choose. So in addition to all the medical health care, we would do that forensic evidence collection and toxicology collection. We don't store that at the hospital. That is stored through law enforcement. So if it's a restricted kit, it does go to law enforcement and remain there. If it's a non-restricted kit, then it is sent by law enforcement up to the Utah Bureau of Forensic Services, which is the crime lab, where they do the testing of that kit. The current legislation says that a restricted kit has to be stored for 20 years and that there should be a diligent effort. That's not the exact wording, but an effort to notify the survivor before any destruction of that evidence occurs so that they have an opportunity to change their mind about having it tested. And then for those kits that are, there is an investigation and testing, then the storage is 50 years. So collecting of these kits gives an opportunity for many years to come. There are some statute of limitations, of course, but it gives an opportunity that for them to make a decision on a later date, potentially, if in this moment they're not ready for an investigation. And like Elizabeth said, there is somewhat of a time frame for collecting that evidence before it's either washed away or destroyed from their body.
Thank you so much. I really appreciate the detail that you went into. Before I move on to your next question, does anybody else have any input they would like to add? All right, we'll move on then. Your next question, Camden, is what can I expect during a sexual assault kit exam? So this is general steps that are going to happen, whether they're at the Children's Justice Center or the hospital.
Sure, absolutely. So when they first arrive at the hospital, generally most patients come through the ER to let us know that they would like an examination. And it is a very basic triage process. So when they first get there, it's going to be checking their vital signs, finding out what the reason that they came to the ER, very brief description once they hear that they're there because of a sexual assault. The ER staff is not going to be asking very many questions other than, are there any emergent medical needs at this moment that need to be addressed by a provider or a physician? And then we do have them evaluated by a physician, and this is going to depend on their level of medical needs at the time, how involved that physician is, but we do want to make sure that nothing emergent is ever missed and that they get appropriate medical care as our priority. When the forensic nurse arrives, which we are not stationed in the hospital, but we usually respond within about 30 minutes of the ER giving us a call, and they're pretty good about calling us right away. The ER also calls the Dove Center to get that advocate, hospital response advocate, to the ER to offer advocacy and support services throughout this examination. When the forensic nurse arrives, obviously we talked a little bit about consent. We want that patient to make the decision about what parts of the process they would like, and we're offering options and choices. And then we go into medical history, we discuss their assault history, and then it is a head-to-toe exam if they're wanting to have the full examination done. That includes doing photography of any injuries that we find, very specific documentation of the injuries. We go into a lot of detail of those injuries that we find. And we also do referrals. So we're sending them to additional medical providers. If they're under the age of 18, they often go to the CJC for a follow-up exam in a couple of weeks. Or if they're an adult, we find out how comfortable they are with their primary care provider in following up with them, or we do have some excellent trauma-informed providers in our area that are willing to do the follow-up care for them. And during the exam, if they are wanting us to, we also do evidence collections, which would include collecting clothing that was worn at the time of the assault, or the first layer of clothing that was worn into the hospital. Because often DNA from certain body areas can continue to come out onto clothing after the fact. So we may ask for clothing, even if it wasn't worn at the time of assault, if there's any chance that there is forensic evidence on that. If we collect clothing, it is not returned. So another piece, the Dove Center is great about having clothing there, but if they are prepared to come into the ER and have a little bit of forethought, they could bring a change of clothing as well. We do have some available, but they may be more comfortable in their own clothing if they want to bring something to wear home. We swab areas of their body where there may be DNA evidence available, such as saliva or semen or epithelial skin cells, where the perpetrator or suspect may have touched the patient or left their DNA on them to help corroborate the story of the survivor. And then additional trace evidence, so things like if there was a tampon or a condom or environmental debris of some kind related to the assault, we would also collect those items and turn them over as evidence. In the cases of drug-facilitated sexual assault, meaning there was a loss of consciousness or an ingestion of food or alcohol or drugs that led to their inability to consent for sex, then we would also collect blood and urine for toxicology if it's within the time frame of ingestion. And I do want to step back for a second too and mention about that 14 to 17 age group. I think I covered the 4 options for the 18 and up, but just know that if you're under the age of 18, there is not a restricted kit option in Utah. So all of those kits will go forward for testing and evaluation. And those patients will, and sorry, I used the word, I intermixed survivor and patient there, but the 14 to 17-year-olds, we will refer to the CJC for a forensic interview, and the 18 and over, we refer to Amy Whipple at the Washington County Attorney's Office for their forensic interview, or they do a forensic interview with law enforcement, which will, I'm sure, be talked about later. So hopefully that clarified a little bit about those options and the difference between minors and adults if they do choose to come to the hospital. And even when a minor comes to the hospital, they're always still given the option of going to the CJC in case they didn't know that was an option. So our team is trained to give them the option so that they know, because they are the only group that really does get an option of where they go for their examination.
Thank you so much for that information. That was super informational and important for us all to know. Does anybody else have any input or any questions for Camden before we move on?
So those medical exams are available for minors here at the Children's Justice Center, and as Cami indicated, for the under 14, we do all of those here. Generally, people will come to us either through the emergency room or through law enforcement or through the Division of Child and Family Services, Child Protective Services. And we can provide all those, all that evidence collection, the HIV, STI, pregnancy, all of that prophylaxis and care here. And the follow-up as well for kids who have been sexually assaulted. And I think it's also important to recognize that our medical team will help kids who may not have been raped, but may have had some other kind of sexual abuse or assault. It's not always going to be a rape. Sometimes it might be some more aggressive grooming behaviors or physical abuse, or just not what you would consider maybe a full-on rape. But we can still help those kids. We can still provide treatment, ongoing support, and some evidence collection as well.
Thank you so much. I appreciate everyone's input. We're going to move on, and I'm going to pass the hosting baton over to Bree so that she can ask some questions to Christy.
Perfect. This next question actually addresses one of the biggest misconceptions about sexual assault, that, sexual assault is perpetrated by strangers. When we know that actually the majority of perpetrators are somebody that the victim, the survivor, knows and trusts. So the question is for Christy, and it is, if I, as a minor, was assaulted by a family member or by a friend, what should I do and what will happen to them?
Okay, so that's a kind of a broad question, and the answer is it depends. But the first thing, and I'm glad you brought this up. So last year in 2020 at the Children's Justice Center, 91% of the alleged perpetrators for the kids that we saw were known to their victim. These are people that kids know. And in fact, 60% of the alleged perpetrators were related to the victim. So what happens next if you report? depends a lot on, and what's going to happen with the perpetrator depends a lot on, are you living with that perpetrator? Is the perpetrator a boyfriend? Is it somebody that you know from school? Is it a grandma? Is it a daycare provider? So it could look really different depending on who that is. Child Protective Services has a responsibility to make sure that kids are safe in their homes. So when there is an allegation of child abuse, whether it's child sex abuse or other kinds of child abuse, there are two investigating agencies, and one is Child Protective Services, and the other is law enforcement. And the Children's Justice Center serves as the home for the multidisciplinary team that is working these cases of child abuse. So law enforcement, Child Protective Services, our medical team, our mental health team, our victim advocates all work together, and our forensic interviewer, to provide services for that child. And the child will come in for a forensic interview usually, and hopefully you only have to tell that story once, because if you think about the worst day of your life, how many times do you want to tell that story? So that's the first thing a victim should know, a young victim should know, is that when you're telling that story, hopefully we all the grown-ups are going to have their act together, and we're going to be able to have you tell that story once and not have to keep repeating it over and over again. So that's one thing you should know. And the other is, you know, we might not have a lot of control over what happens with the perpetrators. Sometimes perpetrators will be charged and sometimes they won't. Sometimes there will be enough evidence and sometimes there won't. And sometimes there will be a plea agreement and sometimes there won't. And sometimes the perpetrator might be another minor and sometimes it might be an adult. But the thing that reporting does, regardless of who that perpetrator might be, is it gives you control of going forward, and it allows you to control what happens with you. So you might, I can't guarantee what's going to happen with anyone else, but with especially child survivors of abuse, by reporting and coming to a Children's Justice Center, we are able to connect you with medical help, with mental health therapy. All of our services are free of charge, with victim advocacy, with someone to help you navigate a court process if there is a court process, with someone to help all of those adults whose job it is to try and keep kids safe, keep you safe. We will coordinate that, and it takes that burden off of you and allows you to take control of that situation to some extent. And so we really do encourage kids to report. And what we find is that when they do, it's often to a friend. And I have teenagers ask me, so my friend reported to me that on their date last week, he or she was assaulted by their date. What should I do? And the answer is, let's see what we can do to get that friend help. So I encourage kids, all kids of all ages, to have a trusted adult they can come to and talk to about this kind of thing. Someone you know is going to do the right thing, and then let the adults do the investigating and worry about the perpetrator, and let's take care of you. Let's worry about you. I hope that answered quite more questions than it asked, but every situation is so different, and every person's reaction is going to be different, right? And in fact, the same person can react to different things in different ways depending on the day and who it is, and so we need to give each other the space and the time to react the way we're going to react. And you know, one day somebody might be angry and somebody else might be sad, and somebody else might feel overwhelmed, and somebody else might feel like fighting, and all of those reactions are okay, and they're all normal, and we all need the space to be able to react that way, and we all need the kids especially, we need to make sure that we're giving all of the opportunities to heal, all of the chances to move on and have a really happy, productive life. Because we know the CDC tells us that 1 in 5 kids will be sexually assaulted before age 18, but that means that 1 in 5 adults are survivors. And look around, there are people doing amazing things who have gotten through some really horrific things in their lives. So getting services and reporting is the key to getting services, and getting services is the key to surviving and thriving in the future.
Thank you so much, Christy. I think everything you said was so helpful. It can be so scary to approach all of this, especially as a kid or a teenager. But I think one of the scariest parts is just not knowing what's going to happen. So it's really helpful to have all that information and to go into this knowing a little bit more about what to expect and what kind of help is available. So thank you so much.
Yeah.
Anybody else want to add anything or ask Christy any additional questions about that? I'll just go ahead and ask you a follow-up question then.
Okay.
The question is just how will the reporting and the prosecution process affect my home and personal life, home and school life?
And again, that's going to depend, right? So if the perpetrator is somebody who lives in your home with you, then Child Protective Services is going to try and help your family create a safety plan so that you're no longer having to live in the same space. But if it's somebody at school, that might look like, let's see if we can switch some schedules around so you're not in the same classes at the same time. So it really depends on who the perpetrator is in terms of what it's going to look like going forward. But whatever it looks like going forward, short term, long term, you're going to be better off if you report. No matter how hard it looks short term, no matter how worried you are about what next week at school looks like, or tomorrow at the dinner table looks like, a year, 2 years, 3 years down the road is going to look better than it would have looked if you didn't report.
Thank you for that. I think it really is so important to know that there's hope and there's healing and there's help. And I love what you said about not just surviving, but thriving. So.
And you're not alone. You might think you're the only person who's ever gone through this, but you're not. You're not. There have been, and a shout out also to guys. Boys can be sexually assaulted too. We see those here. And it's not infrequent that we see that. So if we have any guys who are watching this, know that you're not alone either, and that there are services and help available for you.
That's so important. Thank you for adding that. Anybody else want to add to this?
I just wanted to comment. I work a lot within schools, and what I do is I do a lot of social emotional learning groups within middle and intermediate schools, specifically for students who are at risk or are going through difficult things in their life. And I've had quite a few students who are going through the Children's Justice Court system and who are working with you and with CPS and with the counselors. And I just want to say that I do think that it is really important for them to have this knowledge, and that seeing them get through the process and being able to get that help is so important. So thank you, and thank all of you for what you do. But for my own experience, I just think that it is really important that we all know the systems that are in place so that we can inform people. And I know that I'll be taking this information with me so that I can inform some of my students who haven't reported or aren't ready to report yet.
Well, thank you. That's awesome. And schools professionals are some of the top reporters of child abuse, really working to help us keep our kids safe, along with medical providers and mental health therapists. So thank you.
Awesome. Thank you so much. I'm just going to move on now to Choli Entz. So I have your first question here, and thank you for being here. I know that your day is probably so busy, so I really appreciate that you've taken the time to join us and answer some questions. Your first question is, it's pretty general, but it's, what does a sexual assault investigation look like? And I want to kind of detail this, and what does it look like on your end in the law enforcement world?
Now, that's a great question, actually. There's two different ways that it can look depending on the age of the victim or the survivor, right? So I'll kind of highlight both so we can kind of see they're sort of different, but they have a lot of moving parts that are different, right? So I'll start with the kids just because we just kind of waylaid from that after talking with Christy. But kids is a whole different set of beans in the fact that the number of people involved is generally greater because you have DCFS personnel, CPS, and then the collaborative effort with the CJC and the forensic interviewer all working together with medical to pursue these investigations. But for the law enforcement side on child, really most of these are delayed reporting. Very rarely do we get ones that actually happen and they're able to get a rape kit. But delayed reporting, it's not like it's not investigatable, but the CODAR kit and all that kind of stuff doesn't come into play. So generally we get some sort of information. It either comes in through some sort of a mandatory reporting requirement, or maybe even a parent comes in and they either report it to law enforcement or DCFS. Either one of us that gets it has to report it to the other, because it's always going to be a dual investigation, law enforcement and DCFS. So once we get that information, we will contact the parent if it is a child and see what they want to do, because parents still ultimately have the choice. As long as it's not one of them or in a parental or custodial fashion, they still have the ability to determine what they want that investigation to look like. They could say, no, you know what, if it's an older sibling, I'm perfectly fine handling this in the house. And law enforcement and CPS, as long as that other child is being cared for and is safe, then that's perfectly all right. Parents do have that discretion. But let's say that the parent decides to move forward, then we will coordinate to have that victim interviewed by a forensic interviewer at the Children's Justice Center. Based on the information that comes out of that interview, then that's kind of where the investigation can take different turns. It can be that we go and interview additional witnesses, maybe follow up with some evidence, maybe that, maybe it's at the home or whatever. And then lastly, we're going to follow up with an interview with the suspect to decide what we have, right? And once all that whole piece is kind of gathered, we present the information to the prosecution. And the prosecution is going to make the ultimate decision on whether or not that case is going to be prosecuted. And so in law enforcement, our whole goal and everyone's whole goal here is to make sure that we present the best case to the prosecution so that we can get justice. And that's the ultimate goal. So that's the child kind of investigation. A lot of that parallels with adult. Now, the one thing that I will say, the caveat between the two is with the adults, generally it starts out with a CODAR kit. I'd say most of the time. We tend to have we do have some delayed reporting. But the one caveat that's unlike child sex offenses, anything with an adult has a statute of limitations of 4 years. So time is kind of the essence, so yes, you may not be ready now to report it, but just keep in mind that the clock is ticking the moment that incident happens. And so in order for us to pursue it in the legal side and criminal side, we need to actually start investigating that as soon as you're ready and as soon as possible. On the other hand, child sex offenses, there is no statute of limitation. Obviously some caveats to that, but currently, if it happened when you're 5, you can be investigated when you're 50. So kind of some different legal jargon that you kind of have to muddle your way through. But on the adult side, as long as you're within that statute of limitations, the CODAR kit comes in. Generally, a patrol officer may come and get some initial very basic information from you. That's just to help know whether or not investigations or we need to do something immediately, like your life is in danger or the suspect's going to leave town or evidence is going to be disposed of. So that kind of information is what law enforcement are keying in onto. So once that patrol kind of gathers the initial very broad stroke information about the investigation, they will collect that CODAR kit, place it into evidence, and that case is assigned to a detective that specializes in investigating sex offenses or sexual assaults. Generally, the detective will reach out to the victim to determine, do you want to pursue criminal charges? And that is a key question because, as Cami mentioned, not all victims want criminal action to be taken at that time, and that is perfectly all right. We are perfectly fine saying, all right, we'll just wait until you're ready. And like I said, we have that 4 years, and your CODAR, is collected and it's stored for ample amount of time for us to collect and pursue our criminal investigation. So if the victim at that point says, yes, I'm ready, I want to pursue, then we will schedule a forensic interviewer with the forensic interviewer, Amy Whipple, who does the adult forensic interviews at the Washington County Attorney's Office. We'll get that all set up. Once that interview is done, then again, it's looking for additional witnesses, looking for evidence. Once we have as complete a picture as we can, then we'll try to interview that suspect They may or may not talk to us. That's not always a given, but based on whatever information we have from them, again, we present that to the county attorneys, and then they make the prosecutorial discretion on whether or not to pursue criminal charges. So that's in a nutshell, both of those criminal sides.
Thank you so much for those details. I know that it does seem a little bit secretive on our end, not necessarily as a fault of your own, but it does seem like sometimes we don't know what's going to happen or what that information is going to look like when we give it to someone else. So I really appreciate you going into detail and providing us with your end. I know for me, that would help me feel more secure in pursuing reporting. So thank you. And that does lead us into our next question. But first, I'll take a pause and ask if anybody else has any questions or clarifications or comments about the information Choli just provided. All right, we'll move on. So this next question is one that I've encountered a few times, and I would love to know the answers. Someone is concerned that the person who did this might retaliate if they report. What protections can the criminal justice system provide?
Well, I can certainly provide on the criminal side some of the, I mean, obviously there's some civil protections as well, but the criminal side, you know, we can certainly look into getting a protective order depending upon their relationship, those sorts of things. You know, and the Dove Center and the Victims Advocate can also provide great resources that are outside of that and can actually facilitate those protective orders if those happen to meet the requirements for that. So they're probably best to speak on that part.
Thank you.
Well, I guess that's me.
Yeah.
Really quick, very briefly, we can assist with filing. The protective orders can be filed for online. It's an application. You go through OCAP, utcourts.gov. Yeah, been a while since I tried to do one. The sexual violence protective order, that is the only one that's not able to do just online, but you can go to OCAP and you get instructions. It's all there step by step. And in fact, we put step-by-step instructions for applying for a protective order in the resource packets that we give victims that are survivors at the hospital who go through a sexual assault kit exam. But yes, you can call law enforcement victims advocates for assistance with POs, and then Dove Center can assist as well.
I'd also like to add to that.
We can help with the child protective orders as well. So if you need a child protective order, the Children's Justice Center advocates can do those as well.
Yeah, everything I say out of my mouth, it's all about adults, because I know Christy's here to talk about the kids and the minors. Thank you, Christy. Thank you for being here.
Yeah, it's so good to have so many different voices from different areas. I just wanted to add about the Dove Center too, that if somebody is, if their safety is at risk, then we do also offer a 24-hour shelter that is staffed 24/7, has surveillance cameras and security, and we are prepared to help people find safety and protection that way as well. If no one else has anything else to add to this conversation.
I just wanted to, I know that last question, Choli, wasn't necessarily applicable to you, so I wanted to open up some time if you had anything else you wanted to add, or something that you feel survivors need to know before we move on to Carly. I would love that.
I will just say one other thing, and you mentioned the retaliation piece. And obviously on the criminal side, it is all about protecting that testimony or that victim statements, so that we can also look if there's some sort of tampering or anything like that. There are criminal charges that can come from that, and you know, investigations and then detectives are very keenly aware of that presence of that, and so there is ongoing conversations with victim survivors to determine if there is interactions with the suspects or perpetrators, to see if there's something more that we can do to facilitate, to make sure that their testimony is secure and that they're safe.
Thank you. Yes, I think that's a really important piece of knowledge to have, to know that there's an ongoing conversation and that it's not just a one-point contact, and that you are also there to support through this process. Throw the baton back to Bree.
So the last few questions that we have right now are for Carly, our therapist. the first question is actually kind of three questions in one. But what happens if the perpetrator isn't convicted of the crime? And you might not have experience with that specifically, but from a survivor's perspective, how would that affect mental health? And also, when am I going to feel okay again after all of this?
Yeah. So I have worked with some survivors who have experience moving through the legal system, and where they actually did make the report. The perpetrator was prosecuted, and unfortunately wasn't convicted. And so I think like the first thing that comes to mind that I notice in the therapy space is powerlessness. Like, I just went through this, entire process, deeply exhausting, physically, emotionally, sometimes like spiritually, biologically. Sexual assault impacts us in all of these ways. But yeah, to actually even make the step to report is hugely brave, especially with this like unpredictability piece that we're talking about. But for them to go throughout the whole process of the investigation and a potential trial can be, stripping them of this power that they wanted or needed to have. And so, I think that like sexual assault already feels really, can make us feel really powerless. And so if it doesn't end in conviction, that can be really devastating. I will say though that I want to make mention that a conviction doesn't always represent justice for the survivors that I work with. It's not really up to me to determine what justice looks like for them. Luckily, I'm not in law enforcement or an investigator. And so, I sort of just like ask them, like, what might justice look like for you? And I primarily work with adults. I should probably put that out there too. So, conviction or even prosecution or an arrest may not look like justice for them. And that's not really up to me to determine whether or not that's valid or moral or right. I think that that's based on their experience as a survivor gets to determine that. But yeah, I think that it really can just be like a devastating thing if they move through that entire process. And I can speak a little bit more about kind of how sexual assault in general impacts mental health. I think the next question that you asked was, when am I going to feel okay again? And like Christy mentioned, it's like, it depends. It's such a hard thing to generalize. And it really just depends on kind of what else is going on in somebody's life, what kind of protective factors they have, if they have social supports, if they have economic stability, if they have a family and a culture that supports them and represents them, if they have, maybe they have a prior history of abuse in their lifetime, which will put them at a greater risk of having a more difficult time with sexual assault in adulthood. So it's really difficult to say, and something that I hear a lot from survivors is their family and friends have an expectation on them, whether they say so explicitly or sort of subliminally, like, why aren't you healed yet? Like, it's time to just like get over this. This happened 5, 10, 50 years ago. It's time to like pull yourself up and move forward. And that is a really difficult response for survivors to hear, because they're really trying. Like, when we experience sexual assault, it's not only physically violating, but it violates us in many, many ways, violates like our sense of self. So it's just, healing just isn't linear, and it doesn't look one way for anybody, and just impacts us all really differently. So with, hopefully with adequate support, like we're all talking about here, support groups, therapy, other ways of healing, they can feel okay again. It's just going to feel a little bit different. But if I didn't think that was possible, I wouldn't be a therapist. So it's definitely possible to feel okay, to feel transformed, and to get to that thriving place for sure.
I wanted to ask, are there any coping skills or like grounding techniques that you have seen be successful in helping people to feel okay and helping them to heal?
Yeah, yeah, of course. It's a little bit difficult to generalize. Some of the most basic kind of coping skills or techniques that we teach in the therapy and support group space is grounding skills. So connecting you back to the present moment. That might be kind of getting in touch with your breath. We teach all sorts of different breathing techniques that reminds them that they're a living, breathing thing that's alive on the earth. And that can be helpful. Sometimes it can be really difficult because to be in your body as a sexual assault survivor can feel really unsafe. To be connected to your body, this is one of the most common impacts that I see. We really just want to disconnect from our whole self, our whole body, because we experienced this like really scary thing in our bodies that we end up blaming ourselves for sometimes. And so the breathing technique thing can be a little bit tricky. Other things like connecting to our five senses, whether that's just going outside and like feeling the wind on our skin, or St. George summers, just going out and feeling those rays beat down on you. But even things like during therapy sessions, like I'll have, especially as we've been working from home mostly, I'll have like folks have their pet on their lap or something like that. So it's really determined like by the survivor themselves what might work for them. Eating candy or chocolate, like whatever ends up working for them, is just kind of what we go with.
Thank you for answering all of that. I'm a huge advocate for mental health therapy, and I think it is so important for survivors to access that, to get professional help, guiding them through the healing process. So thank you for what you do. Did anybody want to ask any follow-up questions or give any more input to what Carly has already touched on?
I was just going to mention, oh, sorry, go ahead, Christy.
Tammy. You go first.
And this, Elizabeth may be able to spell this out a little bit better, but the Utah Office for Victims of Crime pays for mental health therapy, I believe up to 20 visits, correct, as an initial allowable. And then there are circumstances where they can expand past that. And I know financially, you mentioned economic stability. Often we hear from survivors who say, well, I just couldn't afford it, so I didn't want to ask. And they assume that they're going to have to pay for certain things. So knowing that all of these services are available, and many of them are paid for, maybe just help be that one piece of information that someone needs to know to come forward and report.
Yeah, totally glad you brought that up, Cami. And we also have additional resources here at the Children's Justice Center. We have a therapist on staff. We can provide therapy at the schools, trauma-based therapy at the schools. We can refer out to community-based therapists, and we have funding to help pay for all of that. So kids don't need to not get therapy. And often the big barrier is getting kids to the therapy, getting kids who can't drive themselves to therapy. And if you got therapy for an hour once a week, that can be rough. Having the therapy available right in the schools has been really helpful for overcoming that burden. But nobody who's been through these kinds of things should have to not get help with their mental health because they can't afford it. There are resources available for kids, for adults. One question I wanted to ask Carly. So as I've been resilience has been a big word for all of us this past year, right? And as I've been kind of doing a little bit of a deep dive into resilience with kids, the stuff that I'm seeing tells me that some of the things you were talking about, the connections, are really key to helping people be resilient and do better after horrific things happen. But another thing that people, that the research is showing, at least for kids, and I'm interested to know if you're seeing this with adults as well, is having a sense of purpose, having a place where they're needed, somebody who needs them, a place they need to show up. That can be really helpful in helping kids be resilient when they've had hard things happen. Do you see that with adults as well?
Yeah, I could definitely see that being a key component for folks to be able to like maintain motivation after something like this happens. Because one of the most common things that we see in the aftermath of a sexual assault, or even I work a lot with folks who've experienced sexual abuse in childhood and now they're adults, right? Or maybe have experienced multiple sexual assault incidences over their lives. But yeah, we see like increased rates of depression. That's one of these components of depression and PTSD is lack of motivation, lack of, a sense of purpose, these feelings of worthlessness, anhedonia, which in mental health field is just loss of interest in things that you used to find pleasurable. And so one of the things that I really like to focus on with clients is like, how do you want to feel? This really bad thing happened to you, or things have happened to you and you felt this way for a really long time. How do you want to feel? And they tell me, well, I want to feel calm. Maybe they felt really like hyper vigilant most of their lives, really unsafe. Okay, I want to feel calm. Okay, so what are we going to do to make you feel calm? What might make someone feel calm? Okay, that means like going for a walk. Maybe that means just cuddling up with your dog in bed. Maybe that means doing some breath work. I don't know. Okay, so we're going to do that thing, 1 or 2 or 3 times a day to increase that feeling of calm. We're relearning how to keep ourselves safe internally. And when I think about doing that, like maybe the purpose post assault is less about like, completing my goals of like going to college or, having, I don't know, taking care of my family or whatever. It's really these like very specific things that we want to focus on doing that can give a sense of purpose. Like, because if I have to think about like 4 years from now, I have to complete my college degree, like, heck no, that feels like way too difficult. So I'm going to think about like, what can I do tomorrow to get me that one step closer to feeling calm enough and safe enough to then potentially maybe complete my college degree. And that can instill a sense of purpose a little bit easier than like, oh, I have to like, how do I feel fulfilled in my life? That's a lot of pressure for like someone that's 20 or 30. But yes, I'm glad that you talked about the resilience piece because I recently went to a training, doing some training in a type of trauma therapy called EMDR. And we learned how self-healing the brain is, the brain and the body. After something traumatic, it just naturally heals itself in whatever way that it can. Sometimes can be really like maybe what we would consider like unhealthy or maladaptive coping. It just does its very best to make us feel better, to protect us. Sometimes this can look like, I don't know, substance use in the aftermath of a sexual assault, like that kind of coping. But those are our very best attempts to heal whatever's going on with us. So when I think about like the ways that people cope in the aftermath of a sexual assault, I think that every single thing that they do, whether it looks healthy or not to us on the outside, is their brain and their body's best attempt to heal itself. And then, we come to therapy or support groups or whatever, and we build new relationships that are safe and healthy. And those actually contribute to our brain's attempts to learn and heal themselves along the way. So yeah, everything's sort of intersecting with each other.
That's so helpful and insightful, and I really appreciate everything that you've shared. I think you were pretty much able to answer that second question that we had prepared for you, just about the impacts of sexual assault. Is there anything else that you wanted to add about that, or do you feel like you've got that covered?
Something that I want to say that I probably see the most often, in addition to like feelings of worthlessness and powerlessness, is even after the assault is obviously not happening anymore. Maybe they're in a safe place now. Our brains are function to protect us. They function to keep us in survival mode. And so we often see folks who are no longer in an unsafe situation, who are behaving as if they are perceiving danger at every corner. And so that's just something that I want like all of the public to be aware of is like a lot of people who've experienced trauma are going to behave in ways that are really, ultimately, they're just trying to protect themselves, but can maybe come off as maybe really disconnected or like they don't care, or aggressive, or just hypervigilant, like can't leave the house. And these are all ways that our brains just doing this, trying to do this healing work without a lot of resources to protect us. And so we're kind of just in this state of this fight, flight, or freeze state constantly. And part of healing looks like reteaching our bodies to recognize when there's actual danger and when there's actually no longer danger. But, you know, we're kind of always scanning our environment to make sure that there isn't danger anymore. And most of the time we do feel like we're in danger. And so we're going to respond in that way. So I've really had to like challenge my perception of what a survivor looks like and how a survivor behaves, because oftentimes, it's sort of not like this quiet, sad little girl or woman crying in the corner. Of course, it can be a male-identified person or an LGBT person or someone who, you know, might end up, I don't know, yelling at me or something like that. Like, we're always just doing our best to protect ourselves. And so, yeah, I've those are kind of two different things, identity and also like behavior, but just how we are and who we are as survivors. I've learned to really challenge that, like, there are no bounds to that.
I really appreciate that. And I think that really helps promote understanding and empathy for each other in our community. So thank you. Did anybody else want to add anything additional or ask any more questions on this topic? I'll let Courtney jump in.
So we've had all of our questions asked to each individual. So I want to open it up again to any other questions or topics that any of you feel would be important for a survivor, for a community member to know. But I'd also like to pose a question that we thought of, and I know you didn't have time to prepare for this, so don't feel, you know, anxious to try and answer it. But we just kind of want to talk about the roles of, you know, survivor versus perpetrator versus bystander. What are some things that people can do to help? You know, coming from a prevention lens, we know that there are a lot of topics like be super aware, take self-defense classes, watch your drinks really closely. But I think that there's a lot more that goes into it as a community piece. So I would love to hear everybody's takes on what people can do to help and how others can stay safe without feeling that they're at fault for what's happening to them. And of course, anything else that you would like to add that doesn't pertain to necessarily that topic.
Just to give you all a chance to think about that for a minute, I would love to just start by offering some insight about preventing sexual violence in our community. And what I have seen so much is that our culture permeates sexual violence. And we see it everywhere in our movies, in our TV shows, in our music. It's everywhere, every single day, maybe in our homes, in our childhoods. And it just becomes normalized because of our culture and because of people around us, maybe even romanticized. And just because our culture normalizes it doesn't mean that it's normal and doesn't mean that it's okay. I think that's one of the biggest things that we as community members can do, is to work on breaking that culture down and changing it. And that might look like speaking up to our friends when they make an inappropriate joke. It might look like believing survivors and not questioning what they were wearing or if they were drinking or any of that. And it might look like learning more about how to set and respect boundaries, or just the components of a healthy relationship, and teaching that to our kids at a really early age. I think one of the biggest things that each of us can do is to ask for consent, no matter if we are in a 10-year serious relationship, no matter if we're married, no matter if it's our boyfriend or girlfriend or any of that, to always make sure that we're respecting people's boundaries and safety and consent, and just doing everything we can to shift that culture to be one of respect instead of violence.
I could talk about this all the rest of the day. I think you're preaching to the choir a little bit here. And And I coming from the world that I'm coming from, I'm going to say yes, 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 and let's start much younger. Let's start with the 2-year-old, teaching our 2-year-old how to make choices. Do you want your green shirt or your blue shirt today? Giving them power to have that choice, giving them the words for their body parts, the correct words, giving them the power to know that they can talk to you about whatever, and you're not going to freak out on them. But the whole concept of creating a group of kids, and by the way, might be the oldest one on this call. I apologize for the rape culture that you have all inherited from us, and my generation can't fix it, but you can. Those of you who are of the younger generation on this call, you can. And I'm so hopeful about that going forward in the future, but it's going to start with teaching kids really young how to have confidence in themselves to make choices. And the other thing I was just going to add is that, COVID has done some really crappy things to us, but it has also done some kind of interesting things in our culture, in that we now are a lot more aware of other people and boundaries, and getting permission before we get into other people's space and boundaries, and realizing that not everybody's going to be the same amount of comfortable with a hug or a handshake or whatever. But I'm really seeing people be more cognizant of that. And I think if there's something good that's come out of COVID, that might be one of those things. I was at the doctor's office not too long ago, and I had, they needed to do some x-rays of my head and my face. And the tech said to me, "I need to position your face. Is it okay if I touched your cheeks?" Who does that? It was awesome. I just wanted to scream hallelujah, because he was asking for my consent as a medical professional to touch me. So I'm with you. I again apologize for the rape culture, but we have it in us to change to a consent culture, and it does start with teaching our kids young to make decisions, to take control of their own bodies, and that they have that option, giving them that power.
Absolutely. And I want to absolutely echo those words that Christy has spoken. And Bree, thank you guys so much. Going from a no means no to yes means yes is a huge shift that we all deserve to make, and that we do deserve to get consent for even those medical procedures or anything that is happening where our bodies or even our minds are involved. We get to consent to any of that activity or that influence. And we have a long ways to go. I think we are moving the needle, but in this community, we do have a lot more work to do, as evidenced by some of our jury trials, and not in 2020, since we didn't really have any jury trials, but in 2019 and 2018, where, consent is a big issue. And it's misunderstood, and it has been for many, many years, because we adopted that no means no, and if they didn't say no, then it must be okay. Where we need to adopt the yes means yes. They have to say it's okay before you can move forward. And absolutely, it starts at a young age. And getting into the schools and getting into those younger minds is really important, but it does start at home, and helping people understand that they need to have those conversations with their own children or even their grandchildren is important, because we can't rely on someone else to teach our kids. We hope that that's out there and education is happening, but it does need to start at home. And I just wanted to talk about a couple other myths that are specific to the sexual assault forensic exam and KIT that I really didn't touch on, but this topic brought that to my mind, is that KIT testing used to take a long time, like up to a couple of years. And I want to make sure everybody is very clear that the Utah State Bureau of Forensic Services has got the KIT testing down to about 3 months or less. Their goal right now is 30-day turnaround on our sexual assault kits. So no longer is that, we used to hear, well, that won't really matter because we're not going to get it back in time to do anything about this. That is changing. We are getting those results much much quicker. And we have ended the backlog in Utah. So all backlog kits have been completed and tested. There are several cold cases that are moving forward. There were several serial rapists that were identified in that backlog kit that are now prosecution is going forward, even with the statute issues where some of those folks are currently on trial for those acts that were committed. So, and I also wanted to mention about the photographs, because I think often hearing that injuries may be photographed and that some of those injuries may be in a private area, that might steer someone away. And I just want to ensure everyone that photographs of sensitive areas, private areas of your body are kept in strict confidence. They are not shared with law enforcement automatically, and they do require a subpoena of a judge who says, yes, this piece of information would be very valuable either in an investigation or in a trial. And so those are not automatically shared. They're not going to be on the internet. No one is going to be viewing those that does not have a need to. So essentially with either the CJC, I'm sure, Safe and Healthy Families providers, or with Southwest Forensic Healthcare, those are kept in very strict confidence and do require a judge to say they need to be viewed. So I just wanted to make sure that got out there, especially after saying we do injury photographs, that doesn't steer someone away from coming to have an examination.
I'll just add a couple comments to echo what everybody else has said and I think the bottom line is education is absolutely essential and key, but perhaps I'm a little pessimistic in life, but I would like to see all sexual assaults eliminated, but it's probably not going to happen in my lifetime. So that being said, the one thing that I think is absolutely key and essential is to believe. And I think that goes to parents, that goes to bystanders and witnesses. You have to believe the victim and the survivor. And that goes so far in helping them on their recovery, as well as just feeling like they're not alone in the whole process. And so I think that's one of the processes and one of the key things that we all work together. And I think our backbone for this whole thing is we start by believing and just know that the survivors out there, that you are not alone. There's plenty of resources. There's plenty of people out there that are there that do believe you.
Thank you, Toli. I notice so often survivors coming in, even dismissing and disbelieving their own experience. And it's not because it didn't happen, but because these blurred lines about what consent and sexual assault is or is not is really, really confusing. It's pretty surprising how often I might say something like that is actual sexual assault, or that could be convicted as a crime potentially. It's like, what? Like, that's my intimate partner. Like, they did that thing and that's criminal somehow. And also, like, really our culture is really wrapped up in like, how can we get particularly women to disbelieve and dismiss their own experiences, to dismiss their body impulses, to all of these things. And so I'm glad that we're talking about starting by believing, and believing when they tell us that this assault or assaults happened, and then believing that they're impacted in a certain way, and believing, sort of all the way through, before, then, and after. So yeah, one of the most interesting parts of working at Dove, one of the most, there's a million things that are really interesting, is working with survivors either on an individual level or in group, and we're talking about the myths about sexual assault that impact them. And those myths, in addition to the assaults themselves, are re-traumatizing. So I hope that we can really stop in our tracks and consider, like, how can we stop this trauma thing from keeping on post-assault too.
Thank you, everybody. This has been wonderful. You guys, it's a real privilege to work with all of you. I am very hopeful that we can change the culture of victim blaming. We can all come to realize how harmful it is for someone to have the courage, and it takes a lot of courage to be able to disclose something so personal and so painful as a sexual assault, and then to have someone respond, maybe a close person, a family member or a friend or roommate, and have that person respond with, well, what were you doing? Well, that wouldn't have just happened. Where were you? Or you must have been drinking. Or the double standard, oh, but he was just drinking, so he didn't mean it. It was an accident. Or why would you put yourself in that situation? It's all those kind of questions. They immediately go to just strangling that person. They are muzzling that person. They are not going to be able to overcome that kind of pain, to be able to say, hey, the very next minute go, okay, maybe they're going to have the strength to be able to say, compartmentalize and just say, this person wasn't safe for me to disclose to. But most likely they're not going to have that sophistication or that ability. They're just going to clamp down. They're not going to seek services. They're not going to call a hotline. They're not going to try to come in for an exam. They're not going to be able to do much. It's going to really stifle them. And that's not good for them in the short or long term. It is not good for our society. The costs of sexual assault on the victims and all of us are huge, horrific. This has got to stop. And it's not going to stop by blaming the wrong person. The person, if we want to prevent, the person who could prevent a sexual assault or a rape is the person that made the choice to commit that act, not the victim of that act. So it's that person who deserves to be held accountable, to be questioned, to be, dealing with the consequences of that person's choices. And teaching our kids that there's consequences to our actions, to our choices. That has to happen young. And teaching them to respect other people's choices about their bodies, about themselves. That's got to happen when they're little bitty too. Just I don't know, I'm jumping over to something else, but something else that was said earlier, some risk reduction strategies for preventing sexual assault. Really, that's all they are, is risk reduction strategies, because in the long run, it is the perpetrator of a crime of power control that is the one that can prevent. But often we are told that if we put the keys between our fingers when we walk out to our car, and if we never go out at night, and if we only go out in pairs, or if we go to parties with friends and we're watching each other's backs, and if we do all these things, there's all these checklists that we have to go down to reduce our risk, to keep us safe. Well, there are a lot of people who do those and they're still sexually assaulted. So that's a little crazy making. There are people who maybe always do that, and the one time they didn't, something happened, or it didn't happen. The only reason you're going to get sexually assaulted is because you're with somebody who's willing to make that choice to do that, not whether you had all your ducks in a row and did everything perfectly, which is insane and impossible and crazy making anyway. So difference between risk reduction strategies and prevention, true prevention. Just don't throw that out there.
Thank you so much for that clarification, Biz. I think one of the problems with that whole perspective is that it puts the blame on the survivor, and that's just contributing to victim blaming and shaming and perpetuating this problem instead of solving it. And that's something that I would like to say and to echo, is just that it's not your fault. It was never your fault, no matter what you did, no matter what you said or wore. Nobody ever deserves to be sexually violated or harassed or assaulted in any way. And it always is the perpetrator's fault, just like you said, Biz. So thank you for that.
Thank you all so much. I hate to have to end this conversation because I feel that we really could go on so long about all the nuances that affect our society and that affect people who have been sexually assaulted. I just want to reiterate that point that starting by believing is the backbone, and that is a really, really important step and the starting place for us to heal as a society and begin to grow into a new culture that doesn't perpetuate these things and does allow victims that room to grow and to come forward and then to heal. I like to call all of us that work in this line of work, the service sandwich. We have people who are working at the beginning, the middle, and the ends, and going through this process. And the survivor really does have to get through start to finish. And it doesn't ever end, the healing process, but us being able to have this conversation together and to all collaborate and know what happens at the beginning, middle, end, and after is so important, for the survivors to know that they are going to be validated at every step, and that we're all working together, and then we are all on the same page about these concepts. I think that is part of safety planning, is to know that we are working together and that we have each other's backs in this process. And I so appreciate all of you for showing up, for doing the work, and for being such incredible people, who are working so hard to, support our survivors and to solve the problem of sexual assault, even though, solving is a big hope for all of us. But that's what we're working towards. And I am so grateful that I get to work alongside all of you. I'll just end with saying, for you all, these events are in the future, but for the people watching this video, we've had a wonderful and eye-opening April, which is Sexual Assault Awareness Month, and we've had a lot of things going on, a lot of information. So find us on Facebook and Instagram. Look up the resources that have been said and work together as a community, because we all deserve to start that healing process within ourselves and with others.